Sawadee and good afternoon, and welcome back to the English language summary of the daily press briefing on the situation of COVID-19, live from the Center for COVID-19 Situation Administration, or the CCSA. Just now we heard briefings from Dr. Apisamai and also Dr. Chawet San, the director from Disease Control Division of the Department of Disease Control from the Ministry of Public Health, and he gave a brief overview of some findings from an expert panel to investigate side effects from vaccinations, and this is just to educate the public that everything is being done with all utmost efforts to ensure that the public is safe while we are moving on with our vaccination drive. I'd like to start today's briefing with recapping the Prime Minister's address to the public via televised broadcast last night. He reiterated Thailand's policy towards reopening the country by October 2021. And this is a goal that we set out to do from the start. He stressed the importance of the country moving forward while coping with COVID-19 as part of our lives, because maintaining the country's economic growth, along with the ability for the people to continue with their livelihoods, are equally important in the long run. People must be able to continue to earn a living and live their lives as normally as possible and as soon as possible. We will also need to adjust our measures to manage any possible outbreaks or health risks with the utmost care that all people living on Thai soil will be supported with preventive disease control measures, as well as medical services and health care that will keep everyone safe from the virus while we continue with our normal daily activities without blanket restrictions. This is a pledge from the Prime Minister, and details of the plan towards the goal to reopen the country were not mentioned yet in the Prime Minister's statement, because these are tasks to relevant agencies concerned, and they will be shared with the public in due course. The Prime Minister also reiterated that we have secured 105 million doses of vaccines, which are right now from 6 suppliers. And these are from Pfizer, Johnson & Johnson, Moderna, AstraZeneca, Sinovac, and Sinopharm. And also he mentioned the Phuket Sandbox, which will be approved by the Cabinet next week. And this particular project will allow travelers who have been vaccinated to enter Phuket with no quarantine restrictions. Phuket will be the pilot project towards our goal of reopening the country. And in the long term, we will continue to pursue our national vaccination drive as aggressively as possible, while also supporting the development of our own homegrown vaccines by our experts and researchers who are also working on solutions to tackle mutated virus variations into account. So, let me move forward now with an update on the number of vaccines that have been administered since the start of our vaccine drive, which was 28th of February 2021. So, as of yesterday, 16th of June 2021, we have administered 222,967 doses of vaccines, and this brings us to the total number of vaccinations to date to over 7 million doses now. Let me move now further to the number of confirmed cases. So the statistics today we have, the new confirmed number of cases we have standing at 3,129 cases. We have a number of new recoveries standing at 4,651 cases. So this also exceeds the number of new confirmed infections. So we have to date a total recoveries of 172,316 cases. Of course, I have to report the new number of fatalities. We have today standing at 30 cases. And again, Bangkok has the highest number of fatalities. And following with Phetchaburi and Samut Prakan, Samut Songkhram, Udon Thani, Sak Kaeo and Narathiwat provinces. And so the accumulated number of fatalities we have standing today is at 1,555 cases, and our sincerest, deepest condolences to the families and friends of the deceased. I'd like now to share with you some of the discussions that took place at the CCSA operational meeting this morning. There was discussions about modifying the quarantine measures for both Thai and foreign nationals traveling into Thailand, which will start next month. And this is to accommodate some changes made to state quarantine facilities for Thai nationals. These measures will be finalized very soon because we're still in discussion, and we will share these details to you in due course. The meeting also discussed some new infections that have still continued to become repeated cases despite measures being imposed. And so these also include infections at television stations and film crew settings. So the CCSA have discussed new prevention measures to be a bit more stringent with the film crew in order to prevent further spreading of the virus. And these measures will include limiting the number of people allowed to be working on set, on site, which should be no more than 20 people or less, depending on the size and the nature of the location. And also, no more than 50 personnel should be present backstage while filming, and no live audience will be permitted on set for the time being. And all scenes, unfortunately, that require close contact are advised to be avoided. There have also been new clusters found in Bangkok. One at the Naval Supply School, where 37 people have been found to be infected with the virus, and the Bangkok Metropolitan Administration is currently monitoring 84 clusters altogether. And the CCSA is also considering that if it is necessary, there will be more stringent measures to be imposed if the situation does not get better. Samut Prakan also has new clusters at a furniture factory and a garment factory, while Samut Sakhon also detected new clusters at a seafood factory. The authorities are monitoring these new clusters very closely, as well as they are conducting active case findings and also in those clusters and the nearby areas. The CCSA has also expressed their appreciation for the patients and those who have been found to be infected for cooperating with the authorities and disclosing their information to assist with active case findings and investigations. And so we also stress that these people are very helpful in disclosing this their information, and therefore no stigmatizing should be existent in society. So, before I go, I'd like to recap that although the vaccination rate is moving at a very fast pace right now, and we are identifying clusters of new infections also very quickly and working on controlling them, containing them very, very well. However, COVID will still be us with for a very long time. So the best way to live with this new normal is to learn how to cope with this situation, while the relevant authorities continue to make sure that everyone, particularly those who are most vulnerable, continue to be safe. And at the same time, our experts and researchers are also continuing to work on long-term medical solutions. Vaccines and adjusting measures as needed, as well as closely monitoring situations to curb the risks, will also be the norm. And the CCSA will share details of any health measures changes and adjustments along with the Phuket Sandbox scheme as soon as possible. So I thank you very much for your kind attention today. Please continue to stay safe and healthy and have a great day. See you again tomorrow. ขอบคุณค่ะ สวัสดีค่ะ
ขอบคุณนะครับท่านผู้อำนวยการกองประมวลและวิเคราะห์ข่าวกรมสารนิเทศกระทรวงการต่างประเทศนะครับ